According to Public Citizens, Amber in California suffers from multiple sclerosis, which is a chronic autoimmune disease that affects the nervous systems where you feel electric shock sensations, spasms, painful eye movement, and sexual dysfunction. Due to their condition, she's been paying high out-of-pocket costs for very important medication, due to her insurance retracting her coverage multiple times. This cost has left her in danger of losing her house, and the stress from all this has led to a decline in her health. Unfortunately, this is a reality for multiple people living in the US. Healthcare should be free in the United States, one of the richest nations on earth. Healthcare is a human right and not a privilege. By having free healthcare, you don't have to worry about the medical costs or even consider not going to the doctor for not being able to afford the cost. According to Baker Institute, accessible, affordable healthcare may enable earlier intervention to prevent or limit risk associated with non-communicable chronic diseases, improve the overall public health of the U.S., and decrease the economic strain associated with a low socioeconomic status. Today, I will discuss how the high cost of healthcare causes financial hardships and prevents many Americans from seeking the necessary medical care they need. Then I will explain how the structure of the U.S. healthcare system contributes to these high costs. And then finally, I will explore how transitioning to a universal healthcare system could make these costs more affordable, accessible to everyone. The problem of healthcare in the United States is it's far too expensive for many Americans to access when they need it. Having health insurance does not mean they could afford the healthcare. People are still responsible for premiums, deductibles, co-pays, and any other out-of-pocket expenses before their insurance fully covers their treatment. In an article titled Healthcare as a Human Right, published by the American Bar Association on November 19, 2018, Mary Garesh shares the story of a woman named Susan who had health insurance, but she still struggled to afford the care. Susan explains, I may pay my premium every month, but it turns out I can't go see my doctor without paying because I haven't yet spent $2,000 this year out of my own pocket. Susan's experience shows that simply having health insurance does not guarantee access to healthcare. When people are already paying monthly premiums but still face thousands of dollars in additional cost, they may be forced to choose between receiving the medical care and paying for necessities such as rent, food, and other bills. And this problem goes beyond individual stories. According to a 2023 report by the Commonwealth Fund comparing the United States to other high-income countries, high out-of-pocket costs can lead nearly half the working-age adults to skip or delay getting the needed care. This is concerning because when people delay going to the doctor because of their high cost, their health condition may worsen and require more serious treatment later. Healthcare costs should never force someone to choose between getting the medical attention they need and protecting themselves financially. Now that we understand the problem, we have to ask why our healthcare system in the United States has become so expensive and difficult to access. One major cause is the way our healthcare system is structured. Instead of having one coordinated system focused primarily on providing the care, the United States has a complicated system involving private insurance companies, employers, government programs, hospitals, and other corporations. Dr. James K. Elsey, a surgeon with 44 years of experience, argues in a 2025 article titled The U.S. Healthcare System is in Crisis, that the system has evolved into a highly corporatized system controlled by a decreasing number of increasingly powerful conglomerates, where the profit is often the main metric of performance and success. He further explains that the system suffers from dysfunctional payment structures, insufficient emphasis on primary and preventive care, and the effects of increasingly corporatized healthcare. It is the result of several systems of our healthcare systems working together inefficiently that causes these issues. Another issue is that the system is extremely complicated. In a 2021 Harvard titled article called Is Our Healthcare System Broken?, Dr. Robert Schmerling explains that people tend to get care in a variety of settings that have little or no connection to each other. He points out that this fragmentation can result in repeated tests, poor communication between doctors, and higher cost. Schmerling also explains that the health insurance being tied to employment can make access unstable because losing a job can also put someone's healthcare coverage at risk. On top of that, insurance companies may delay or deny coverage for certain medication, tests, and treatments in efforts to control their costs. All these problems show that healthcare is unaffordable, not simply because medical care itself is expensive, but because how our current system is designed, financed, and organized. Before we can make healthcare more affordable, we have to address the structure that has contributed to these costs in the first place. Finally, let's look at a solution. Instead of trying to completely make a new healthcare system on our own, the United States should use other countries with successful universal healthcare systems as guidelines for reforming ours. A peer-reviewed article examining the healthcare system of Canada, France, Germany, and Great Britain explains that these countries use very different methods to fund universal healthcare, and concludes, in all four nations, citizens record high, though not unreserved or uncritical, satisfaction with their healthcare system. This is important because these systems may not be perfect, but the people living under them are generally satisfied with the healthcare they receive. Rather than starting from scratch, the United States can study what these countries are doing successfully while also looking at the problems they have faced, and use those lessons to build systems that better fit our country. An example is Taiwan that shows how this could actually be done. According to the Commonwealth Fund, Taiwan once had a fragmented healthcare system with more than 10 different insurance programs and 59% of its population being covered. When Taiwan decided to reform its system, the planning process, which involved studying health insurance systems abroad, led to the merging of various public insurance programs under a single payer system. Today, Taiwan has universal coverage with 100% of its population insured under its national health insurance systems. The United States should take a similar approach, study what has worked and failed in other nations, and use those lessons as guidelines to create a universal healthcare system that works for Americans. Making this change will not be quick or easy. Changing the healthcare system that has existed for decades would require time, corporations, and major political decisions. We can help push that change forward by advocating for universal healthcare, contacting our representatives, and voting for candidates whose healthcare proposals support expanding affordable and universal coverage. And change may not happen after one election or after one protest, but continuing to make our voices heard can put pressure on our government to make healthcare accessible to everyone. So today I have discussed how the high cost of healthcare can leave Americans struggling financially or even cause to delay the medical care they need. We explored how complicated and fragmented the structure of the U.S. healthcare system contributes to this problem. Finally, we can look at how the United States can learn from countries that have already established universal healthcare systems and use their success and mistakes as guidelines to build a system that works for Americans. We live in one of the wealthiest countries in the world, yet getting sick can mean between choosing your health and your financial security. Healthcare should not depend on the size of your paycheck or the insurance card on your wallet. It should be something every person can count on when they need it on the most. Healthcare is not a privilege, it is a human right.